I'm a skeptic. I'm a skeptic because it's hard to make scar tissue go away. But if we had something that could stop the formation of the scar tissue, I'd be all in favor of that. I'm still a skeptic because the lung is such a complex group of cells, all involved in the process of transmitting blood and air into one space, where there's a tiny little membrane separating them, and you can restore that in some way or keep that from being a problem. We don't know which of the cells, blood side, air side, interstitial side, meaning the space in between, that are really important to this process. And you can't just turn off all fibrosis, because we need fibrosis for things like when you cut your finger, you want to have a little fibrosis form there and heal the wound for you. So there's some fibrosis that's good. It's just we don't want it in that large quantity. So I'm a skeptic. I hope somebody proves me wrong. It would be really great. I am worried about fraud regarding stem cells.
60 minutes.
Yeah, I didn't see the 60 Minutes show, but I'm aware of in pulmonary hypertension. I know of one program in which it was advertised, go down to Florida, have a large sample of blood taken, you send it off to, this group would send it off to Israel, where they would enrich it for the stem cells and then send it back to one of the islands in the Caribbean, and the doctor would make a weekly visit down to the Caribbean to inject all the patients who sent their blood off to Israel, and that was their stem cell transplant. And the reason he did it in the Caribbean, other than the fact that it was a nice place to go, was that it's not against the law down there to do it. It is in the United States. Because there's, this is hocus pocus. You have no idea what you're getting. So I worry about that side. But even in the long term, I'm a little skeptical.
On exercise, I've been a long time regular walker. I've had to cut back on the distance and the pace of walking. And I worry about what walking might do to the rest of my body, not just the lungs, the heart, probably.
Unless there's some medical problem that says you shouldn't walk. For instance, if you had such bad coronary artery disease that the increased work puts too much stress on your heart. But part of treating patients with heart disease is rehab. That is, go to the gym and walk. There are cardiac rehab programs that are for patients with heart failure, and get people up, find out what they can do, and try and improve it with activity. And you can do that, even in patients with bad heart disease. Now, I'm not telling you to do that on your own. I'm telling you to make sure it's safe before you do it. Nothing can make you better as far as activity. Nothing can make you better than physical therapy. Good for the heart, good for the lungs. How about the bones? Yes, it's good for the bones. It'll strengthen the bones.
As far as somebody walking without pulmonary rehab, if you have pulmonary fibrosis, they should be on oxygen. They should be walking with oxygen to defeat the purpose, right? You're not getting the full dose benefit of the activity. Right. You gotta have the oxygen.
You need to make sure your oxygen levels are maintained during the activity. And that's one of the great thing about going to a physical rehab program, a pulmonary rehab program, is they're going to pay attention to that when you're exercising, so they know at this level of exercise, this is how much oxygen you need. You've got a prescription for it. And over time, that may change, so sometimes you have to measure it again and see what it is.
Is BCE planning a transplant department anytime in the near future? It just seems like we could really use it here.
You have several $1 million you want to invest? There are a number of conversations that are ongoing at VCU about reinstituting the lung transplant program. I don't know what the outcome will be. But I do know that in the absence of a program at VCU, I'm very happy to send people over to Dr. Weeder over at the University of Virginia, or to Dr. Nathan up in Fairfax, or down to Duke to Dr. Zass. 3 very good transplant programs. They're available. Yeah, they're not next door, but they're pretty close. Yeah.
Any more questions? Please.
Dr. Fairman, I know you ain't God, you're good to look at, I know that, right? But listen, if both my lungs failed when I had total knee replacement, is it being ridiculous to think I can have surgery again and that don't happen again? They didn't know it would happen. I was at Johnson Willis when I had my knee done, and both my lungs collapsed. And I was in ICU for a long time, right? And now the same doctor told me he'd never operate on me again because he don't have the gumption. I may not die on the table, right? But is that being real? What's the word for? Is that being realistic or just overcautious? You know, if I'm gonna go, right? But the pain and stuff dealing with that is awful, right?
I'm gonna have to say it's probably not realistic, but I need some more details before.
You don't want to save my life. I'm serious. My doctors didn't know what to do, and gave me your name, and they got you on the phone. That's what made me turn around.
Are you going to blame me for everything?
No. You were the good part of it, I'm saying. You're the good part of it. You know? Because of you, I have turned my progress around. That's what I'm saying.
Well, let's have a talk.
Thank you so much, Dr.